Hi, this is Dr. Nick. I'm here at the Digital Health Summit at CES 2020, and I'm delighted to be welcoming Pamela Spence. She is the Global Health Sciences and Wellness at Ernst & Young. Thanks for joining me.
Thank you very much, Nick.
So, tell us, Pamela, you presented at the summit. You talked a little bit about data and the fluidity of data. Tell us what you found in that data and what the opportunity you see with the liberation of it.
I think liberation is a very interesting term, but for me, I think the industry is grappling with where value is going to be created and also captured in the future. And there's a lot of discussion, and I'm involved with it, how can companies use data to create value ultimately for patients? I think it's going to be those companies that can unlock the power within data, because data in itself is valueless. It's what you do with the data, the analysis of the data. So unlocking the power within the data, and you will have seen the exponential 36% compound growth rate in health data over the next few years. So companies that are going to be the most successful in the future will be those that can connect data streams, combine the data streams, but more importantly, share the insights from those data streams back to a variety of different stakeholder groups to really unlock innovation. And obviously we in healthcare define innovation as delivering a better outcome to the patient, but in a very personalized way, because we have the opportunity now with the data that's being collected, the analysis through AI, perhaps 5G as a transportation method, to really understand what is going on in our bodies and our treatments at a very individual level, and we're not treating mass populations anymore. So really it's unlocking the power of data to fuel innovation. That's where winning companies are going to be.
So it's no longer patients with X, it's the patient.
An N of one.
Exactly.
Individualized care, and we're seeing some of that obviously coming out in cell and gene therapies already, where medicines are being bespoked for a specific person's genetic makeup, and that is transformational and curative, not just treating.
Well, I think we all want to be the N of one when we come to treatment. We don't want to be part of a group.
Well, exactly, and I think, again, the understanding of data and understanding how our individual bodies work, because no one's the same as somebody else, actually makes that really possible, and it's very exciting.
And what's interesting about this is that it drives you towards this different and unique environment that we didn't have before, where potentially the physician and the clinical community might know less about the disease because they're covering many patients, whereas the patient is dealing with their own.
Exactly, and we talk a lot about disruption in today as well, but I often think about the power shift that occurs between the different components, the stakeholder groups in the industry, and us as patient consumers. We have access to more data, we become more empowered, and I could see a world going forwards that the whole infrastructure of healthcare will revolve around us, because we're more demanding, us as being patient consumers, rather than us having to traipse into an antiquated infrastructure. So healthcare comes to us as a patient rather than we have to go to the healthcare institutions. I think it's going to be very exciting.
And from a patient standpoint, I think much more personalized, individualized attention, focus on me and my conditions, and learning from other people, but bringing all that to bear so that I get the best of whatever's available today.
Absolutely. Very exciting times.
So as you think about the future, what's going to happen and how are we going to bring that to reality? Because I feel like I've been talking about this for a while.
And indeed, we touched on that this morning, but I think it's the ability for interoperability between different data sets. Because unless we start to have that, we're not going to unlock the potential knowledge that's existing in the different data sets, and I think that is something that big tech is working on, and I think very successfully, because of course patient data or health data used to be only at the hospital or in the doctor's office. But now with the explosion of
It's everywhere.
measurements, it's everywhere. So it becomes even more important to have that interoperability. And walking the floor at CES, it's really quite exciting to see what innovations
Yeah,
are
there's
happening.
25% more data just based on the numbers that they say of the
There you
expansion,
go.
right? So what are we going to do with that data? We're going to start to improve, essentially, prevent. So I think it will move towards this well care, right?
Well, predictability about who might be more susceptible to what, and then taking interventions to actually stop us getting the disease, but if we do, curing rather than just treating.
Fantastic, exciting times, and it feels like the physician is going to become the Yoda in this. Exciting this is, we would say.
Well, I think everyone's got a part to play, but the consumer and the patient is certainly going to become more discerning, more impactful, and more demanding.
Fantastic. So Pamela, it remains for me to thank you for joining me here at the Digital Health Summit.
Thank you very much.
This is Dr. Nick. I'm here at the Digital Health Summit at CES 2020.